Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
management of management of dysmenorrhea. If it is primary dysmenorrhea, then we can give NSAIDs can be given. Oral contraceptive pills can be given. These oral contraceptive pills makes the cycle anovulatory. Synthetic estrogen has negative feedback on follicle stimulating hormone, and synthetic progesterone has negative feedback on luteinizing hormone. So, as a result, the oral contraceptive pills, they will not, there will be no ovulation because of decreased follicle stimulating hormone and luteinizing hormone, and thus they become anovulatory. Vaginal rings can be given. Levonorgestrel or Mirena makes the cycle anovulatory. Then the treatment of secondary dysmenorrhea. In secondary dysmenorrhea, treat the cause of dysmenorrhea first. Pain, if present at the time of ovulation, it is called as Mittel-Schmerz syndrome. That is, Mittel-Schmerz syndrome is a mid-cycle pain or the pain which is seen 2 weeks before menses. Management.
Mittel-Schmerz pain syndrome is seen. Uh, Pain is seen 2 weeks before menstrual cycle, so that is at the time of ovulation.
thank you and thank you for watching.